I just wanted to take a moment to go over how to complete your clinical paperwork. First of all, what I have here is a patient care report, and your patient care report will need to be completed on every patient encounter you have. It does not matter what type of encounter it is. If it's a refusal, an invalid assist, it does not matter. On every patient contact you have, you should be doing an assessment. It does not matter what type of patient it is. So all patients need to get an assessment so that you can get through this program. Now this is the patient care report. Here I just have some basic demographics. I've got the patient's age, the patient's sex, the date that you ran the call, and the county the call originated in. Then there's an area here for you to write your narrative. Now when you're writing your narrative, I want you to get with your preceptor and see how they write their narrative, and then you kind of get them to help guide you in filling out your narrative. You are not to copy their narrative. You need to do your own narrative, okay? So every skill that you do needs to be documented in this narrative, and I'll tell you more about that in just a bit. Down here you have where you do your vital signs. You're going to do your blood pressure, pulse, respirations, and AVPU, and put the time in here. If you do not put the time in, then it did not count, okay? Then you need to print your name, then sign your name, print your preceptor's name, and then sign. Then your preceptor should sign this, okay? Now one thing, let me go and throw this out here. If any of this paperwork is incomplete in any way, then that call will not count. That means that you need to fill in the time. Now that does not mean you have to do all these sets of vital signs. You can have that blank, but if you do a vital sign, it needs a time, and it needs all the vitals there, unless there's a reason why you didn't take them. And if there's a reason why you didn't take them, then you need to put in the narrative the reason why. Now if you run out of room on this narrative here, you can use the back of your paper. Just make sure you write continued on there, okay? Now there's another form that you're going to need. Which is not that one. Not that one. Hold on one second. This one. Alright, so this is the form that you're going to fill out. You'll fill one of these out per day. So if you go on multiple days, you'll fill one out per day. The other one, the PCR, you'll fill out on every patient contact. This one, it's one out per day. So you need 10 patient assessments, okay? So here you're going to print your name at the top and put the date of the clinical rotation that you're doing. Now up here, right here where it says 1 through 10, those are patient contacts that you did that day. Now here in this line, this is the minimum that I want you to do to get through these, to get through this. And I'm going to just blow it up a little bit here. And you can see you need 10 contacts, 5 assessments of breathing, 5 pulses, assessment of skin color and temperature 5 times, assessment of pupils 5 times, obtaining blood pressure 5 times, history, and so on. I would like for you to have closer to 10. Now just because you meet a minimum here does not mean that that is good enough. So you need to really have closer to 10 than anything else. Alright, now these are just some minimums, but however, the more you have, the better. So, how do you fill this out? Well, first make sure you have your name and the date of the rotation up there. Then here, when you get patient number 1, total patient contacts, you would put right here an initial. That would be an initial by your preceptor. You get them an initial that you had a patient contact. Then an assessment of breathing. If you assess breathing, which you should be, doing on every patient, have them initial it. Obtaining a pulse, something you should be on every patient, there, and so on. Okay, so you want to make sure that you get your preceptor to initial in these blocks, that you perform these skills. And you need to perform all these skills while you're on your rotation. Now, whenever you are done, what you're going to do next is you're going to get the preceptor's name, and you're going to print their name there, and then you're going to have them sign it here at the bottom, and then also have them date it. Also, you need to put the time that you arrived and the time that you left. Alright, this has to be filled out completely. Now, on every patient contact, that does not mean that you're going to have your preceptor initial each and every block. That's okay. But you cannot have a patient contact and not have this stuff checked. For instance, if you do have a patient contact, you should be obtaining a blood pressure on almost all of them. But sometimes there's a chance where you may not, but you will assess a pulse at least. But you may not use the wheeled stretcher, or you may not transfer the patient between stretcher and bed. That may not happen, so those would be blank. But if you did do that, then your preceptor would initial that. So this paperwork needs to be filled out completely. If it is not filled out completely, well, then it will not be accepted. If you have any questions or any issues with it, please let me know, and I will be glad to help you. Alright? Thank you very much, and like I said, if you have any questions, please let me know.